It's an issue now of scarcity. It's an issue of supply.
As vaccine supply hits a new low across the state, it's even more crucial the vaccine is getting into the arms of those most vulnerable.
Frustrated when people that are more resourced, that are wealthier, more connected, perhaps more technically savvy, and find out about information, get ahead of the line.
Yet the governor's administration allowed that to happen.
Some people are not getting appointments.
Kimi Hori is a fitness instructor in Santa Clara County. Back on January 7th, she and her colleagues were told they were eligible to receive the vaccine under Tier 1A after the state released guidance. Roles like outdoor recreational facilities, facilitating outdoor exercise, qualified under the classification of healthcare workers.
Even at my own health club, there was an email that went out saying, hey, disperse this to your people. And I was like, hold on.
Yet word spread fast about the alleged new classification. A manager at the Bay Club in Santa Clara was tagged in this post on Facebook, encouraging her colleagues to call a toll-free number at Kaiser Permanente to schedule their appointment. Writing, quote, yes, you are a healthcare worker. Check line 22.
We're not healthcare.
How many fitness instructors do you believe have taken advantage of this classification?
About 15 to 20 that I know of have taken advantage of this classification, or this loophole that we call it. But there are, so many emails that have gone out from the different clubs in the area, as well as, just thousands of fitness instructors in general. So imagine all 1,000 of them clogging the system.
Were any of these fitness instructors you're speaking of 65 or older?
These are instructors who are strong and healthy, and they're probably just over 25 to between 40, 45 even.
The Bay Club corporate headquarters, which has 23 locations across California, encouraged their employees of all ages to get vaccinated starting in January. ABC7 received the following statement. We were pleased to see outdoor recreation was included in healthcare. As such, we shared that information with our employees so they could begin the process of receiving vaccinations. But it wasn't until last Friday the state changed the rules. The Bay Club wrote, to our disappointment, on Friday, February 5th, we were notified that the state had made changes to the specifics in the healthcare sector and no longer allowed outdoor recreation to be included in Tier 1A.
We should really allow these vaccines to go to the healthcare workers, to the elderly, to those who are eligible for real.
So why did it take a month for the state to realize that? We reached out to the California Department of Public Health for an answer, but have yet to hear back.
Whenever somebody puts themselves in line ahead of another person, they're putting another person's life at risk.
Santa Clara County Supervisor Cindy Chavez says it's infuriating as high-risk communities in her district are struggling to access the vaccine.
If you're 75 and older and you're Latino in our community, we've only vaccinated, I think, about 5,000 out of 45,000.
Will you make it a priority to make sure the state is aware of this, to ensure there's better oversight?
We have been on an ongoing basis communicating with the state and at a local level to try to be as crystal clear as we can.
But apparently, it's not clear enough.
There needs to be a lot more diligence in ensuring that they check the IDs of the people who are going in and making the appointments.
Hori says some of her fitness colleagues have still been able to get vaccinated even after the rule change. Several colleagues well under 65 sent texts to other instructors this week after successfully getting a vaccine and encouraged them to still try.
They're not being checked. They're not being checked, so they go to whatever hospital they go to and they've been vaccinated.
The question is, how many took advantage of the loophole before it closed, and is it really being enforced?